Welcome to the deep dive. Ever wondered, what could actually go wrong in that tiny protected space where your pet's eye sits?
Yeah, the orbit. Yeah.
Exactly. We're diving into the, well, fascinating and sometimes pretty alarming world of veterinary orbital diseases.
hmm
Specifically, conditions that sort of mess with the position and function of an animal's eyeball right there in its socket.
That's a good way to put it.
Mm-hmm.
Think of it as like troubleshooting for the eye's immediate neighborhood.
Right.
Understanding what can happen in this really complex area is, I think, key for any pet owner.
And to help us navigate this, we've got a fantastic guide, Veterinary Orbital Diseases and Treatments. It's packed with information.
It really is.
And our mission today is basically to pull out the crucial insights for you. We want to make sense of common eye socket issues in dogs and cats, what kicks them off, how you might spot them, and the general game plan vets use for diagnosis and treatment.
Yeah, trying to keep it clear, not get bogged down in all the technical jargon.
Sure. Exactly. We're aiming for clarity, not complexity. Okay, so let's maybe unpack this by tackling a fundamental question. What does it even look like when an eyeball isn't quite where it's supposed to be?
That's a perfect starting point.
Yeah.
We generally see three main ways the eyeball can be out of its normal position. First, there's exophthalmos.
Exophthalmos, okay.
Yeah, imagine the eye bulging forward, almost like it's, well, trying to pop out a bit.
Okay.
The most common reason for this is something taking up extra space behind the eye's equator. Maybe a growth or some swelling pushing it forward.
Something behind it.
Exactly. So for you as a pet owner, the big thing to keep in mind with a bulging eye is that it's often, due to something growing back there, maybe an infection or sometimes even a problem with the salivary gland, particularly in dogs. Recognizing this quickly is really key.
Something pushing from behind, got it. So what about the opposite of that?
Right, that would be an ophthalmos.
Yeah.
That's where the eyeball sinks back into the socket. It gives it a kind of sunken appearance.
Sunken.
And this usually happens because there's either a decrease in the normal volume of the orbit itself, or, interestingly, something taking up space in front of the eye's equator.
Huh, interesting. So something in front could almost like allow the eye to retreat further back.
Precisely. And the third way,
Yeah.
that's strabismus, which you might recognize more commonly as like crossed eyes or maybe a squint.
Ah, right. Strabismus.
Here, the eyeball deviates from its normal alignment and the animal just can't correct it on its own. This often comes down to an imbalance in the muscles controlling eye movement, or maybe something physically preventing those muscles from working properly.
Okay, so we have bulging exophthalmos, sinking in ophthalmos, and crossing strabismus. Now, how do these actually, show up in our pets? What are the clues an owner might notice? Let's start again with exophthalmos, that forward bulge. What might we actually see?
Okay, so there are several signs to watch for. If your vet tries to gently push the eyeball back into the socket, that test is called retropulsion.
Retropulsion, right.
They'll likely find it difficult, or maybe even impossible if there's a solid mass. You might also see discharge from the eye. This could be watery, serious, or could be thicker, more like pus, mucopurulent.
Okay.
Another common sign is chemosis. That's basically swelling of the conjunctiva, the clear tissue that covers the white part of the eye.
Right, that pink tissue gets all puffy.
Exactly. The eyelids themselves might look swollen too. And because the eye is pushed forward, the animal might not be able to fully close its eyelids over it. We call that lagophthalmos,
Lagophthalmos.
which means the eye surface isn't getting properly lubricated.
So because the eye can't fully close, it's like constantly having a really dry eye, which I imagine can be incredibly irritating and even lead to damage on the eye's surface.
It absolutely can be, and that damage is called exposure keratitis. It can even lead to painful ulcers on the cornea, the clear front part of the eye.
Ouch. That sounds really uncomfortable.
It definitely is. And interestingly, some animals with a bulging eye will actually show pain when they open their mouth wide.
Really? Why is that?
Well, it suggests there's likely inflammation or pressure on the tissues right behind the eye, near the jaw joint and chewing muscles. So opening the mouth stretches or presses on that sensitive area.
Ah, okay. That makes sense.
You might also notice the third eyelid, that little flap in the corner of the eye, sticking out more than usual. When this protrusion happens, can actually give us a hint about where the problem might be located within the orbit, whether it's outside the muscle cone or maybe inside it. And of course, if the optic nerve connecting the eye to the brain is affected, there can be vision problems.
Right.
And when we look into the back of the eye with an ophthalmoscope, We might see things like a detached retina, maybe vascular congestion, or swelling of the optic nerve itself.
Wow.
In some cases where there's nerve damage, specifically cranial nerve 5, you might even see a specific type of corneal inflammation called neurotropic keratitis. And if the cause is something like an abscess or cellulitis, your pet might also have a fever and just seem generally unwell, maybe lethargic.
Yep.
Importantly, though, the pressure inside the eye itself, the intraocular pressure, or IOP, is usually normal with exophthalmos. That helps distinguish it from something like glaucoma.
That's a really key point. Okay, that's a lot to keep an eye out for, literally. What about an ophthalmos, the sunken eye? What are the telltale signs there? Are they as obvious?
The signs of a sunken eye can be a bit more subtle, I'd say. You might notice mitosis, which is just a drooping of the upper eyelid.
Ptosis? Okay.
The third eyelid often becomes more prominent, seems to cover more of the eye. And over time, you might actually notice a decrease in the size of the muscles around the eye, like atrophy.
Hmm.
In really severe cases, the lower eyelid might even roll inward, which we call entropion. And that can cause irritation because the hairs rub on the cornea.
Right, that secondary irritation. Okay. And strabismus, the crossed eye look. That seems like it would be pretty obvious usually.
Yes. Generally, the most noticeable sign is the visible deviation of one or both eyes from their normal, straight alignment. It's worth remembering, though, that strabismus can sometimes occur along with ecophthalmos or anophthalmos.
Ah, okay. So it can be combined.
Exactly. And there are a couple of specific examples maybe worth mentioning. Siamese cats often have a congenital strabismus. They're just born with it. It's due to an abnormal crossing of the visual pathways in their brain.
Interesting.
And there's also a type of strabismus that we see more commonly in Shar-Pei dogs.
Okay, good to know. So we know what to look for. Now let's turn detective and explore what could actually be lurking behind these changes. What are the common causes, say, of exophthalmos, the bulging?
Right. Well, there's quite a range of possibilities. Growths or tumors, neoplasms, are a significant concern.
Mm-hmm.
These can either start right there in the eye socket itself, primary tumors, or they can spread there from somewhere else in the body, secondary or metastatic tumors. Infections, like abscesses or cellulitis, are also relatively common culprits. These can be caused by bacteria or sometimes fungi. Interestingly, fungal infections seem to be seen a bit more often in cats than dogs. And we always have to consider if maybe a foreign object like a grass seed or a twig fragment might have gotten lodged in the orbit and set off an infection.
Right, migrating foreign bottles, yeah.
Another cause, and this one is specific to dogs, is something called a zygomatic mucus seal.
Ah, you mentioned that earlier. What exactly is it?
Think of it as like a blocked or swollen duct of a salivary gland, the zygomatic salivary gland, which sits right near the eye socket in dogs. It forms a sort of cyst filled with saliva-like fluid.
Wow, that's fascinating that it doesn't really happen in cats. Is there a specific anatomical reason for that difference?
That's a great question. It really comes down to the anatomy. The specific drainage pathways of the salivary glands are different in dogs versus cats. The zygomatic salivary gland duct in dogs just runs quite close to the orbit and seems more prone to blockage and swelling right there.
Huh. Very interesting. What else can cause a bulging eye?
Well, inflammation of the muscles around the eye, which we call myositis, can also lead to exophthalmos.
Myositis muscle inflammation.
Yeah. This can affect the muscles we use for chewing, the muscles of mastication, or it can affect the actual muscles that move the eyeball, the extraocular muscles. There are different types, like eosinophilic myositis or extraocular polymyositis.
Okay.
And there are even some breeds that seem to be more predisposed to certain types of myositis, like German Shepherds, Golden Retrievers, and Weimaraners.
Good to know about breed predispositions.
Trauma to the head is another one. It can cause bleeding into the orbit, creating an orbital hemorrhage which physically pushes the eye forward.
Makes sense.
And then there are some less common causes, like abnormal connections between arteries and veins back there in an arteriovenous fistula, or maybe enlarged veins, called a varix.
That's quite a list of potential culprits for bulging. Now, what about the flip side? What might cause the eye to sink back into the socket, that in ophthalmos?
Well, sometimes simple ocular pain itself can cause the eye to retract slightly due to muscle spasms.
Okay.
Then there's structural issues with the eye itself. Like if the eye is abnormally small from birth, that's microthomia. Or if it has shrunk down and is no longer functional after severe disease or injury, that's theesis bulbi.
Thesis bulbi. Okay.
Or even if the eyeball itself is collapsed due to a penetrating injury, All those can lead to the eye appearing sunken.
Right. Less volume in the globe itself.
Yeah, exactly. Then there's Horner syndrome. That's a neurological condition affecting the sympathetic nerves to the face and eye. And one of the signs can be ophthalmos, along with a droopy eyelid and small pupil.
Ah, Horner's.
Other possibilities include, well, severe dehydration or a literal loss of the fat or muscle tissue within the orbit that normally cushions and supports the eye. This can happen with starvation or certain muscle-wasting diseases.
Okay.
And in certain dog breeds with those long, narrow heads, dolichocephalic breeds like greyhounds or collies, a slightly sunken appearance can actually be considered sort of normal for their conformation.
So breed matters there too.
It can, yeah. And finally, just like with exophthalmos, growths or tumors can be involved, but in this case, they'd likely be located in the front part of the orbit, rostrally, potentially pushing the globe backwards or interfering with the structures that hold it forward.
Got it. And bringing us back quickly to strabismus, that deviation of the eyes, what are the typical reasons for that?
As we sort of touched on earlier, a primary cause is a problem with the nerves that control the eye muscles, an abnormal nerve supply.
Neurological.
Yes. Also, anything that physically restricts the movement of those muscles. For example, scar tissue that might form after an injury or significant inflammation back there can tether a muscle and prevent normal movement.
Ah, like adhesions.
Exactly. And in cases where an eye has popped out of the socket and been put back in that traumatic event we call proptosis,
Right.
sometimes the attachments of the eye muscles can be damaged during the injury or even during the replacement, and that can also result in a persistent strabismus afterwards.
Okay. Now, considering all these potential problems, are there certain factors that might make an animal more likely to develop these orbital diseases? You mentioned breeds for myositis and conformation.
Yes, definitely. One really significant factor is breed, particularly for proptosis. Those adorable brachycephalic
The
breeds.
short-nosed ones.
Exactly, the ones with the short, flattened faces like pugs, bulldogs, Pekingese, Shih Tzus. They are much more prone to the eye popping out of the socket proptosis.
Why is that exactly?
It's simply because their eye sockets tend to be much shallower. There's just less bony orbit protecting and holding the eyeball in place compared to breeds with longer noses. So less force is needed to displace the globe. They're definitely at a higher risk for that specific traumatic type of orbital issue.
That makes total sense, less of a deep cup to hold the eye securely in place. Now, when a vet suspects an orbital problem, what else might they need to consider? What are the conditions that could maybe look similar, differentials?
That's a crucial step. It's really important to rule out other eye conditions that might mimic orbital disease. For instance, an enlarged eye due to glaucoma.
High pressure inside the eye?
Right. We call that a ophthalmic lobe. It can cause the eye to look like it's bulging forward. However, with glaucoma, you typically see that high pressure inside the IOP would be elevated. The cornea might look cloudy or hazy, and the overall size or diameter of the eyeball itself would actually be increased.
Okay, so measuring pressure and size is key there.
Yes. Another condition to consider is episcleritis, which is inflammation of the outer white layer of the eye, the sclera, or the tissue just over it. This can sometimes make the eye look a bit raised or like there's a swelling or bulge in a specific area. But usually with episcleritis, the pressure inside the eye is normal or maybe even low, and the vet might see other signs of inflammation within the front part of the eye, like aqueous flare.
Got it. So it sounds like the vet has to be a real Sherlock Holmes, piecing together all the clues. What kind of insights can the speed at which the problem develops and maybe how painful it seems tell you?
Absolutely. The history is critical. A really sudden onset of a bulging eye exophthalmos often suggests something inflammatory brewing in the orbit, like that abscess or cellulitis we talked about.
Okay, acute onset points to inflammation.
Generally, yes.
Yeah.
If the animal is also showing significant pain, especially that pain when trying to open its mouth, that also points more towards inflammation or infection rather than, say, a slowly growing tumor, which is often less painful initially.
Makes sense.
Now, those zygomatic mucosales, the salivary gland issues in dogs, they can be a bit variable. They might pop up quickly or develop more slowly, and the amount of discomfort can vary quite a bit, too. If both eyes start bulging at the same time bilaterally, that strongly suggests a more systemic problem affecting both orbits. Certain types of muscle inflammation often present this way.
Like that myositis you mentioned.
Exactly. There's a condition called extraocular polymyositis that can affect both sets of eye muscles. And interestingly, a parasitic infection called Neospora caninum has been linked to bilateral myositis and exophthalmos, particularly in young dogs, sometimes German short-haired pointers.
Wow, a parasite causing bulging eyes.
It can happen. On the other hand, if an eye slowly, progressively, and pretty painlessly starts to bulge out over weeks or months, especially if it's just one eye, well, that's much more concerning for a neoplastic process, a growth or tumor.
Okay, slow and painless often means neoplasia. That's a really helpful distinction. And what about lab work? Can running some blood tests give us any useful information here?
Yeah, routine blood tests like a complete blood count, CBC, and a general biochemistry panel are actually often within normal limits in animals with orbital disease.
Oh, really? So not always helpful.
Not always diagnostic on their own, no.
Yeah.
However, if there is an active infection like an abscess or significant inflammation like cellulitis or myositis, we might see changes in the white blood cell count on the CBC, what we call the leukogram, maybe an increase in neutrophils.
An inflammatory leukogram.
Exactly. And in specific types of muscle inflammation, like that eosinophilic myositis, we might actually see an increase in a particular type of white blood cell called eosinophils in the blood count.
So while blood work isn't always the key diagnostic, it can definitely provide some helpful supporting clues about inflammation or infection.
Okay, so lab work can give us hints, but to really see what's going on behind the eye, that's where imaging techniques come into play, right?
Yeah.
Ultrasound, CT, MRI.
Exactly. That's where we get a much clearer picture. Orbital ultrasound can be a great initial, often readily available tool to get a look at the structures behind the eye. It's non-invasive.
But for more detailed information, CT scans and MRI are incredibly valuable. They give us much better anatomical detail. They allow us to really define the size and extent of any masses or fluid collections, see if bone is involved, and they can even help differentiate between different types of muscle inflammation sometimes.
So CT and MRI are kind of the gold standard for detail.
Often, yes, especially for planning surgery if that's needed. Taking x-rays of the skull, specifically looking at the sinuses and nasal passages, can also be useful to see if a problem in those areas, like a sinus infection or tumor, might be extending into the orbit.
Good point. Checking adjacent structures.
And of course, if we suspect a cancerous tumor, we might also take chest x-rays or maybe even do a CT scan of the chest to look for any signs of metastasis spread to the lungs.
Standard cancer workup. Got it. And beyond these high-tech imaging tools, what are some of the physical examinations or maybe more hands-on tests a vet might perform?
Well, one of the very first things a vet will do is assess that retropulsion we mentioned earlier, gently trying to push the eyeball back into its socket through the closed eyelids. If there's a significant mass or swelling behind the eye, this retropulsion will be difficult or maybe even impossible. That's a key sign right there.
Okay, resistance to retropulsion.
Yes. A thorough oral examination is also crucial. Looking and feeling carefully behind the last upper molar tooth on the affected side. Swelling or pain there can be a strong indicator of an orbital abscess, especially one originating from a tooth root or perhaps that zygomatic mucocele.
Yuck in the mouth connection.
Definitely. Ocular ultrasound, as we mentioned, can be done right there in the clinic often, giving us a real-time view of the tissues behind the eye. And a very useful diagnostic technique is fine needle aspiration, or FNA.
Taking a sample with a needle.
Exactly. It involves inserting a very thin needle, usually guided by feel or sometimes ultrasound, into the orbit to collect a small sample of cells or fluid. This sample can then be examined under a microscope, that's cytology, to look for inflammatory cells, infectious organisms, or even cancerous cells. We can also send the sample for culture to identify any specific bacteria or fungi that might be present and check their antibiotic sensitivity.
So SNA can give you a lot of info.
It really can. It can be very helpful in diagnosing abscesses, mucosal, certain types of inflammation, and even some types of tumors, though it's not always definitive for neoplasia.
What if the FNA isn't conclusive?
Good question. If the results from aspiration aren't clear, then a surgical biopsy, where a larger piece of tissue is actually removed, might be necessary. This gives the pathologist more tissue architecture to look at.
More invasive, but potentially more definitive.
Right. And in cases where we specifically suspect muscle inflammation, myositis, a biopsy of the affected chewing muscles, or sometimes the eye muscles themselves might be taken. There are even special lab tests that can look for antibodies against specific muscle fibers, like type 2M fibers in masticatory myositis.
Wow, very specific tests.
Yeah. And just quickly, for strabismus, that eye deviation, a test called a forced duction test can be performed under sedation or anesthesia. The vet gently grasps the conjunctiva with forceps and tries to move the eyeball in different directions.
To see if it's stuck.
Essentially, yes, to see if there's any physical restriction to movement. This helps determine if the deviation is due to a nerve problem where the eye can be moved passively or a mechanical issue, like scar tissue, where movement is physically limited.
Okay, that makes sense. That's a really comprehensive set of diagnostic tools. Now let's shift gears and talk about how these issues are actually treated. We know that proptosis, the eye popping out, has its own specific emergency treatment plan. But what about these other orbital diseases? Let's start with those orbital abscesses and cellulitis, the infections.
Okay, so for an infection behind the eye, the primary goal is obviously to get rid of the infection and reduce the resulting inflammation. Draining any formed abscess, if one is present, can be very helpful for removing the bulk of the infectious material.
Right, get the pus out.
Exactly. Though sometimes the infection is more of a diffuse cellulitis without a clear pocket of pus that you can easily drain. If there's noticeable swelling in the mouth behind that last molar, establishing surgical drainage through that area, intrally, is often the preferred approach.
Going in through the mouth.
Yes,
Okay.
carefully dissecting bluntly just behind that last tooth. But this needs to be done very carefully to avoid damaging the optic nerve and other important blood vessels and nerves back there.
Right, delicate structures.
Very. Systemic antibiotics are always a crucial part of the treatment, regardless of drainage. We typically choose broad-spectrum antibiotics initially, often ones that are effective against anaerobic bacteria as well, since those are common in oral-related infections.
Right, like clindamycin or amoxicillin clavulanate.
Precisely. Those are common choices. Anti-inflammatory medications like NSAIDs or sometimes short courses of corticosteroids if infection is controlled are also used to help reduce swelling and pain. And critically, it's important to keep the surface of the eye well lubricated with artificial tears or ointments to prevent it from drying out due to the swelling or inability to blink fully.
Corneal protection.
Always. In severe cases, the animal might need to be hospitalized for intravenous fluids and injectable medications, more intensive care. After any surgical drainage, providing soft food so they don't have to chew hard, and maybe applying warm compresses to the area can help with healing and comfort.
Okay, that sounds like a solid plan for infections. What about when the diagnosis is more serious, like a tumor, an orbital neoplasm? Those sound particularly challenging.
They are, unfortunately. Sadly, orbital tumors in animals are often malignant, meaning cancerous. The best chance for a good outcome, or at least extending quality life, usually involves early and aggressive treatment. This might mean surgically removing the entire contents of the orbit, including the eye and surrounding tissues, a procedure called exoneration.
Wow, removing everything.
It's a major surgery, but sometimes necessary to try and get clean margins around the tumor. In some cases, maybe if the tumor type is less aggressive or if preserving vision is a possibility, exploratory surgery might be performed to remove as much of the tumor as possible. We call that debulking. Often this is done using a surgical approach from the side of the head, a lateral orbitotomy.
Okay.
But because these tumors can be aggressive and have a tendency to recur locally or spread elsewhere, additional treatments like chemotherapy or radiation therapy are often recommended after surgery.
Adjunctive therapy.
Exactly. Without these adjunctive therapies, the prognosis for many malignant orbital tumors is often quite guarded, sadly, with survival times potentially only weeks to months in some cases. Consulting with a veterinary oncologist, a cancer specialist, is really important in these situations to discuss all the treatment options, the expected prognosis, and quality of life considerations.
Yeah, specialist input seems crucial there. It's a challenging road for pet owners, and that guidance is key.
Absolutely.
And what about those zygomatic mucocilies, the salivary gland issues specific to dogs? How are those typically handled?
Sometimes, believe it or not, a course of antibiotics and maybe corticosteroids might be enough to resolve a zygomatic mucosily, especially if there's secondary inflammation.
Oh, really? Medication might work.
It might, but often they tend to recur or don't fully resolve. In those cases, surgical removal of the cyst itself and the affected zygomatic salivary gland is usually a very effective and often curative procedure. Once the source is gone, it generally doesn't come back.
So surgery is often the definitive fix there.
Yeah.
Okay. Finally, what about strabismus, the eye deviation? How do vets typically approach managing that? Is it always correctable?
Well, it depends on the cause. If the strabismus is secondary to an underlying neurological problem, then the focus, naturally, will be on identifying and treating that primary condition, if possible. Sometimes, if the nerve issue resolves, the strabismus might improve.
Makes sense. Treat the cause.
But strabismus that's caused by physical restriction of the eye muscles, maybe from that scar tissue after an injury or severe inflammation, what we call restrictive strabismus, that can be much more difficult to correct surgically.
Why is that?
The surgery itself is complex. Options might involve trying to carefully reposition the affected muscle, or maybe even remove small sections of the opposing muscle to try and improve the alignment. But these procedures can be tricky, the anatomy is delicate, and the results aren't always predictable or perfect. Sometimes the improvement is only partial.
So it might not be a cosmetic fix always?
Exactly. In some cases, especially if the deviation isn't causing major functional problems or discomfort, the goal might be more focused on just ensuring the animal is comfortable and the eye surface is healthy, rather than achieving perfect cosmetic alignment.
Okay. So medications clearly play a vital role in managing many of these conditions. Can you recap some of the key drugs that might be used across the board?
Sure. For almost any animal presented with the axophthalmos, lubricating the cornea is absolutely essential. Artificial tear solutions or ointments, maybe several times a day, to prevent dryness and potential ulcers.
Lubrication first.
Always. If an ulcer does develop because of exposure, then we'll use topical antibiotic eye drops or ointments frequently to prevent or treat infection. And sometimes cycloplegic medications, like atropine eye drops, might be used. These help to dilate the pupil but also relax muscle spasms inside the eye, which can alleviate pain associated with ulcers or inflammation. For orbital abscesses and cellulitis, as we discussed, systemic antibiotics are key oral or sometimes injectable initially. We'll often choose drugs with good penetration into tissue and bone, and importantly, coverage against those anaerobic bacteria. Examples again might be clindamycin, amoxicillin clavulinate, maybe metronidazole in combination.
Right.
If we suspect or confirm a fungal infection, systemic antifungal medications like fluconazole or posaconazole might be necessary, especially for something like orbital aspergillosis, which can be tough to treat.
And anti-inflammatories.
Yes, systemic anti-inflammatories are usually needed. Corticosteroids like prednisone or nonsteroidal anti-inflammatory drugs, and SAIs like carprofen or meloxicam, can be given systemically to help reduce inflammation, swelling, and pain. The choice depends a bit on the suspected cause and severity.
Okay.
And specifically for acute myositis, that muscle inflammation, we typically treat that aggressively with systemic corticosteroids, often starting with fairly high immunosuppressive doses and then gradually tapering the dose down over several weeks or even months based on response.
High-dose steroids for myositis.
Initially, yes. In some cases of recurrent or more severe myositis, particularly the masticatory muscle type, an additional immunosuppressant medication called azathioprine might be used, either in combination with or after the steroids, to help maintain remission. However, this drug requires careful monitoring.
Which brings us perfectly to some important safety considerations. Are there any specific precautions or monitoring needed when using these medications?
Absolutely, very important point. It's really critical to avoid using systemic corticosteroids, especially at high doses, if there's a suspicion or confirmation of a deep fungal infection, as the steroids can suppress the immune system and actually make those infections significantly worse.
Right, steroids and fungal infections don't mix well.
Not at all. And as we just touched on, azathioprine can have potential side effects, including impacting the bone marrow and liver function. So, regular blood tests, specifically CBCs, to check white blood cells and platelets, and biochemistry panels to monitor liver enzymes are essential in animals receiving this medication.
Yeah.
Usually monitored every few weeks initially, then maybe less frequently if stable.
Okay, careful monitoring with azathioprine. And what about the general follow-up care once treatment for, say, an inflammatory condition has begun?
For inflammatory orbital diseases like abscesses or cellulitis or even myositis under treatment, we typically want to re-examine the animal frequently at first, maybe once a week initially, or even sooner if things aren't improving as expected. We continue monitoring until the clinical signs, the bulging, the pain, the discharge, have clearly resolved.
Okay.
Owners should also be instructed to watch very closely at home for any signs of the problem returning, especially if a hidden foreign object was suspected but never found, as those can sometimes cause recurrence if not fully removed or walled off.
Good point about recurrence.
And it's worth noting that fungal infections often require a much longer course of treatment than bacterial ones. Therapy might need to continue for many weeks, sometimes even for a full 60 days after all the visible signs seem to have disappeared, to ensure the fungus is truly eradicated.
Wow, long-term commitment for fungal cases. Finally, despite everyone's best efforts, what are some of the potential serious complications that can arise from orbital diseases, even with appropriate treatment?
Unfortunately, even with prompt and proper care, some serious outcomes are possible just due to the nature of these diseases and the location. These can include permanent vision loss in the affected eye, sometimes blindness. In some cases, the damage might be too severe or the disease process too aggressive, necessitating surgical removal of the eye, enucleation, or
Orbital
exaggeration.
loss of the eye.
Yes. There could also be a permanent abnormal position of the eyeball, like a persistent strabismus or slight bulge, even after the underlying cause is treated. And in very severe cases, particularly with aggressive infections that might spread or malignant tumors, unfortunately, the condition could even be life-threatening, leading to death.
A really important reminder of the potential seriousness of these conditions, definitely. So, just to kind of wrap up our deep dive today, we've navigated the complexities of veterinary orbital diseases. We've seen how they can impact the position and function of an animal's eye in various ways.
Mhm.
We've explored the wide array of causes, everything from infections and inflammation to growths and trauma, and learned how getting to the right diagnosis often relies heavily on good imaging, ultrasound, CT, MRI, and sometimes getting tissue samples via FNA or biopsy.
That's right. And we've covered the different treatment strategies, which really vary widely depending entirely on what the underlying problem actually is.
And I think understanding these potential issues is so valuable for you, the listener, as a pet owner. Just being aware of the possible signs, the bulging, the sinking, the squinting, the pain can lead to earlier detection.
Which almost always leads to potentially much better outcomes for your furry family member.
Mm.
Even just recognizing subtle changes early on and understanding a little bit about the diagnostic process your vet might undertake can help ease some of the anxiety if your pet ever develops these kinds of problems.
Absolutely. And on that note, here's maybe a final thought for you to consider. Given the really intricate connection between the eye and all the structures packed in right around it, like the sinuses, the teeth roots, the nerves that run nearby, what other, maybe seemingly unrelated symptoms might sometimes hint at an underlying issue back there in the orbit?
That's a great point.
Perhaps you could start by looking into the interesting and surprisingly common link between dental problems in pets like tooth root abscesses and the development of orbital disease as a starting point for your own further exploration.
Yeah, the connection is definitely there.
Thanks so much for joining us for this deep dive.